Hello, my dear viewers. Welcome to my channel, The Vinay Voice. So today we are going to listen about the part 2 of the parotid gland. In the earlier classes, I have discussed about all the relations to the parotid gland. So now we will discuss about the other parts of the parotid gland. So here, the structures present within the parotid gland. So what are the structures present here? It contains the facial nerve, the retromandibular vein, and the external carotid artery. I repeat, so this parotid gland will contain the three structures. Those are facial nerve, retromandibular vein, and external carotid artery. So, this is the typical diagram representing the parotid gland. As you see that these imaginary lines will indicate the parotid gland. So here the yellow colored structure is the facial nerve. So the facial nerve is divided into two divisions, right? So you can see here. First one, it is the temporofacial trunk. This is the temporofacial trunk. This temporofacial trunk divided into two more branches. Those are temporal branch and the zygomatic branch. Next, the other division is the cervicofacial trunk. So this is the cervicofacial trunk and it is divided into further four more branches. Those are upper buccal branch, lower buccal branch, marginal mandibular branch, and along with that the cervical branch. So these are the mainly six branches of the facial nerve trunk which is passing through the parotid gland. So next, see here. So this imaginary line indicates the parotid gland and this is the vein known as retromandibular vein. See here, this is the retromandibular vein. So how this retromandibular vein is formed? So it is formed by the union of superficial temporal vein. This is a superficial temporal vein and maxillary vein. This is the maxillary vein. I repeat, this retromandibular vein is formed by the union of superficial temporal vein and the maxillary vein. Okay. Further, see here the retromandibular vein came here and it is divided into two more divisions. This is the one division and this is the another division. So this division is known as anterior division and this division is known as posterior division. So here this anterior division is joined by facial vein. This is the facial vein. This anterior division is joined by facial vein to form the common facial vein. And here the posterior division is joined by posterior auricular vein to form the external jugular vein. So when you get the retromandibular vein as any question from the parotid gland, you should draw this diagram. Okay. Next. So artery. So what is the artery present which is passes through the parotid gland? It is the external carotid artery. So this is the external carotid artery. So now what are the branches of this external carotid artery? Those are, see here, this is the first branch, that is superficial temporal artery, and it is the next branch. This is the transverse facial artery and this is one more branch. This is the maxillary artery and here we have one more branch. It is the posterior auricular artery. So this external carotid artery mainly have four branches. Those are posterior auricular artery, superficial temporal artery, transverse facial artery, and along with maxillary artery. Here the main arteries are maxillary artery and the superficial temporal artery. Okay. Next. So this is a diagram indicating the parotid duct. You can see that this yellowish colored structure is known as the parotid gland and this is the duct which is known as the parotid duct. Okay. So this parotid duct is also known as the Stenson's duct. It is 5 centimeter long. It emerges from the middle of the anterior border of the gland. As you can see that this is the anterior border of the parotid gland. So it arises from the anterior border of the parotid gland and into the vestibule of the mouth. Okay, and open into the vestibule of the mouth. So which is opposite to the second upper molar teeth. Okay. So this is about the parotid duct. It is also known as Stenson's duct. So let's recall, this parotid duct emerges from the middle of the anterior border of parotid gland, open into vestibule of the mouth opposite the crown of upper second molar teeth. Okay. Next, this is the course of parotid duct. See here, this is the parotid gland. It is the masseter muscle and it is the ramus of the mandible. So, while in the course, this parotid duct pierces some structures. Those are buccal pad of fat, buccopharyngeal fascia, buccinator muscle, and the mucous membrane. So, these are the structures pierced by the parotid duct. And one more thing, you have three bends. Those are first bend, second bend, and the third bend. Okay, so those are three bends. So where the first bend occur? The first bend occurred at when it is piercing the buccal pod of fat. Okay, the first bend occur when it is piercing the buccal pad of fat. The second bend occur after piercing from the buccinator muscle. After piercing from the buccinator muscle, the third bend occur before entering into the parotid papillae by piercing the mucous membrane. I repeat, the third bend occur before entering into the parotid papillae by piercing the mucous membrane. So, when you got the Stenson's duct or the parotid duct as a 3-mark question, you should draw a diagram and you should label this diagram and should write about the bends. There are 3 bends. Okay, right. Next, nerve supply. It is supplied by parasympathetic. It is secretomotor in nature and a sympathetic and the sensory fibers. So, the parasympathetic secretomotor supply is provided through the auriculotemporal nerve. It is provided by the auriculotemporal nerve, and sympathetic supply, it is derived from the sympathetic plexus, and the sensory supply, it is derived from the auriculotemporal nerve and the greater auricular nerve. So just here is a memory session, so you should remember all the nerves. That's all. I repeat, the parasympathetic by the auriculotemporal nerve, the sympathetic by sympathetic plexus, the sensory nerve by the auriculotemporal nerve, and the greater auricular nerve. Right. Next. Next we'll go for the arterial supply and the venous drainage. So this is the artery. Which artery? External carotid artery. So the arterial supply of the parotid gland is done by external carotid artery and the superficial temporal artery. So I repeat, this external carotid artery and the superficial temporal artery are the two main arteries which are supplying the parotid gland. Okay. Next, venous drainage. How the venous drainage will occur? It is done by the retromandibular vein. See here, this is the retromandibular vein and the external jugular vein. So I repeat, the venous drainage of the parotid gland is done by retromandibular vein and the external jugular vein. Okay. Next. So those are the things. The arterial supply is by the external carotid artery, superficial temporal artery. The venous drainage is by the retromandibular vein and the external jugular vein. Okay. Next, lymphatic drainage. So the lymphatic drainage is done by superficial and deep parotid lymph nodes. So there are some lymph nodes present around the parotid gland. Those are superficial and deep parotid lymph nodes. So these superficial and deep parotid lymph nodes will drain into deep cervical lymph nodes. So they will drain into deep cervical lymph nodes. Okay. Next, clinical correlation. After writing the whole answer, it is very important to write the clinical correlation. Or else, if you get a clinical question, the question will be framed from this syndrome. So clinical correlation of the parotid gland is Ferry syndrome. So what is the Ferry syndrome? That is when a person eats the ipsilateral cheek. That means which part is affected? The same side of cheek. The parotid region becomes red, hot and painful. So when a person eat any sort of food, the ipsilateral cheek will become red, hot and painful. It is associated with the beads of perception, that is known as gustatory sweating. So gustatory sweating means when a person eat anything, there will be a redness, hot and painful over the cheek region. It is known as the gustatory sweating. See once here. So this is the example of the Ferry syndrome. Here you can see the redness over the parotid region, right? So when a person take any sort of food, okay, when a person take any sort of food, there will be a redness, hot and painful and sweating will be there around the ipsilateral cheek. And next, when a person shaves, there is the cutaneous hyperesthesia in front of ear. What is meant by cutaneous hyperesthesia? That means it is the increased sensitivity to the stimulus. So when there is a given any sort of stimulus, there will be increased sensitivity. So this is known as the Ferry syndrome, and you can also draw this picture as a rough diagram for the Ferry syndrome. Okay, so this is about the parotid gland. The part 1 link will be provided in the description. Please go and watch. So at last, I would like to request you, my dear friends, to please share my channel to your friends, drop a like and follow us, comment your opinion on my video, and please do subscribe, and hope you will like it. Okay, thank you for giving this opportunity. Have a great day, my dear friends. Bye bye, take care.